Hello, good day, and welcome to Health is Wealth. My name is Joseph Kadri. The program for this week is centered around the partnership between the Gambian Ministry of Health and the federal government, domiciled with the Medical and Laboratory Science Council of Nigeria, MLSCN, where the Ministry of Health of the Gambia is in Nigeria, in the headquarters of the MLSCN, to understudy a regulatory process. Of course, the Gambia wants to do something similar with what we have in the MLSCN, saddled with the regulation of laboratory practice in Nigeria, be it education, foreign trained, in vitro production of equipment, and so many others. All of that power to oversee the practice and, of course, the production, importation of laboratory equipment is handed over to the MLSCN. And so the Gambian is in Nigeria to understudy what we have, so that they will make a bill, pass it to their own parliament, and of course, if it's scaled through, they'll have something similar with us. And so I'll take you through what the representative of the Ministry of Health of the Gambia said when, of course, he was hosted by the acting registrar of the MLSCN, Dr. Donald Ofili. Let's take a look.
This visit is a very important visit for the strengthening and development of the laboratory professional and services in the Gambia. But to start with, I will say this gap has been identified about 1 year ago when UKHSA visited the Gambia to discuss with the Ministry of Health to see what are the gaps that are in place, and they can come into support to address those gaps. Among the gaps that have been identified is the lack of a medical laboratory council for the Gambia that is supposed to regulate laboratory personnel and laboratory services in general in the Gambia. They took up the responsibility. Communications were done between us, WAHO, and then the Council Nigeria for the Gambia to work with the Nigeria Laboratory Council to develop the act that will be eventually used for the development of the Laboratory Council. The reason being, why Nigeria? Someone said, why Nigeria? Because I think history has shown that Nigeria is one of the countries that have first, I can say in West Africa, established a laboratory council. You have a lot of experience. You'll have a lot of story to tell. So for us, I don't think we have any option within the sub-region than Nigeria to work with them for us to develop our act that will get back for the regulation of laboratory services in the Gambia. We know that laboratory standards at the moment, according to the ISO 15189, is patient satisfaction. And we cannot achieve this without quality, without biosafety, biosecurity, without putting on all our laboratory systems in place for us to get that patient satisfaction. And we cannot get that if people who are supposed to provide these services are not being regulated, are not being licensed, or are not being monitored or assessed to see whether they have the capacities to deliver that patient satisfaction that we are looking for. And as a result, is the laboratory act or counsel that we need in order to achieve that as a country. On behalf of the Minister of the Gambia, Dr. Ahmad Lamin Samate, whom I have met before coming here, and he said, please extend my appreciation for the Nigeria Laboratory Council for accepting the team from the Gambia to go and work with them for the development of the Laboratory Act. He said he would have been happy to be here so that he also contributes to this noble article that we are trying to put together to develop for the Gambia. But he said he knows that we'll be in safe hands when we get here. And then he has no doubt that whatever we're going to get from here will be a satisfactory document that the Gambia can use for the regulation of laboratory personnel and services in the Gambia. So it's good that I extend this message to each and every one of you, especially the Secretary to the Laboratory Council of Nigeria. Before I conclude, I would like to thank WAHO for their support, UKHSA, and the Medical Laboratory Council of Nigeria. WAHO has always been there for us, and they have done a lot for the Gambia. And then anytime we have issues, we easily run to them for them to rescue us to solve some of our problems. And immediately when this issue came up, we said, where can we go? And then the issue of WAHO comes. Yes, they have always been there, and they have not disappointed us. When the request was sent by the Honorable Minister, it was accepted and approved. And then it's because of their support that the team, we are here. UKHSA, for your information, they are our partners, and they have done a lot for the Gambia. One of the most important things that they've done is building our capacity in terms of what we call sustainability service delivery. Just to tell you one thing, for the first time in the Gambia, under the National Public Health Laboratories, we have 2 of our biomedical engineering staff who have been licensed. They have been licensed to license and certified by safety cabinet within the Gambia and within the sub-region.
Right, you've heard it clear from him. It's something that we should applaud ourselves. We should applaud the MLSCN for what they are perceived out there. Like you heard from the Gambian citizen, Nigeria is one country that they have looked up to in terms of health practices, and particularly the regulation of laboratory practice in Nigeria. And of course, that is something that is worthy of emulation and has taken the lead in the African region. And that is why Nigeria is chosen as a country to understudy in terms of medical laboratory regulation, so they can have something similar in their own country. All right, away from that, we'll now take a look at what the UK head of Health Security Agency, as well as the ECOWAS Regional Center for Disease Control, who were also part of that entourage, part of the study tour, said during that conversation with the acting registrar of the MLSCN. Let's take a look.
When you are in a home, you have people there that they warmly received you. And I'm happy to say that the registrar, I knew him before I joined the UK Security Agency, even the past registrar and the rest, and all the colleagues, most of the colleagues here. We've worked together in one thing or the other, and I know the kind of capacity that is actually resided in this agency. So I have no doubts to stand behind any recommendation for the council. So I'd like to also say that I warmly also bring the greetings from my past leader, my country lead, Dr. Olushola Aruna. We were here the first time she came here with me to actually also speak about this. And I think it was also part of the reception we were given that also led to the continuation and believing that this thing can come true. Thank you so much for this opportunity to be able to collaborate. And I believe it will yield more than...
This activity is of great interest to us at ECOWAS Regional Center for Surveillance and Disease Control because it directly addresses one of our region's most urgent needs, which is ensuring that medical laboratories are well regulated, professionally managed, and capable of supporting detection, surveillance, and response. Medical laboratories are the backbone of public health. The COVID-19 pandemic, together with recent outbreaks of Lassa fever, cholera, and Embarks, reminds us that without strong and reliable laboratory systems, our ability to diagnose, monitor, and respond to threats is severely compromised. In the Gambia, the absence of National Regulatory Council has created gaps in licensing, quality assurance, and professional development. The Act to establish a Medical Laboratory Science Council will therefore be a milestone in strengthening national systems and a model for others in our region to emulate. The expected regional impact for this is, nationally, the establishment of a functional regulatory council to oversee laboratories and professionals in the Gambia. And in the ECOWAS region, there will be harmonized approaches to regulation and accreditation, enhancing trust and collaboration across borders. For ECOWAS, improved preparedness and resilience to outbreaks through stronger laboratory governance and capacity. As RCSDC, our role as a regional coordinator includes to strengthen public health surveillance across member states, enhance laboratory capacity through training, quality assurance, and mentorship. We support outbreak preparedness and rapid response. We foster cross-border and multi-sectoral cooperation, and we promote research and innovation for evidence-based decisions. This coordination role is why we are here, linking national efforts with regional strategies and to mobilize technical partnership for lasting impact. Commitment and call to action. This workshop is not just a meeting, it is a platform for action to let us strengthen regulations and accreditation to guarantee quality, build the capacity of laboratory professionals, promote regional collaboration and knowledge exchange, and also to advocate for sustainable investment in laboratory systems. Our vision is clear. A region where laboratories are well regulated, resilient, and capable of delivering accurate and timely results to safeguard our people's health.
Now, just to get the summary of what this is about, we interviewed both of them, and this is what they say concerning what Nigeria is and how Nigeria is perceived and what the study tour means for Nigeria. Take a look.
What is happening here, the journey started about a year plus in 2023. The UKHSA, which is our former country lead, traveled and they went for the assembly of the health ministers in 2023, and there was a meeting where a request was made by the Gambian, the Honorable Minister, to request to support their country, that's the Ministry of Health, the Gambian National Public Health Laboratory, because of some gap that are actually very obvious in the system. And that was, the request was made through the WAU. And then we came into Gambia in 2023, October, to assess, to do scoping, And then we're able to see that one of the basic challenge that the country need to address quickly is about the regulation of the laboratory practice in the country, because they have a very minimal, very lower number of medical lab scientists, but the practice are not really regulated, and some of the private labs are also existing. So they're asking support, which we now suggested that we have a system in Nigeria, the Medical Lab Science Council of Nigeria, and that they will be able to provide that support, which is where the journey has led us to today. There was a front and back of different level of collaboration that is required from the Federal Ministry of Health, where the council is situated, and also we also needed support also with ECOWAS RCSDC, because they were actually the agency for WOW for the West African regional support. So we have to work with these two to make sure that this is able to come through today. I think that's why everyone is here gathering together today and saying that the development of the bill to set up the Medical Lab Science Council in the Gambia is actually commenced in the council.
So this is like understudying MLSCN?
Yes, understudying MLSCN, and also being able to understand the practice and what they do and how they will need to really capture the content that will fit into the Gambian operations.
Yeah, so what are the key things you think they should go home with?
Okay, so for me, they would, maybe at the end of this particular visit, which is what they are doing now, a study visit, and they will need to go back home, one, with the understanding of operations of medical laboratory regulation in Nigeria. They've gone around the system, they see the different departments, so they will need to understand the regulation, and they will also need to be able to put together some level of draft bill that could be able to be presented in the Gambia.
So what this means for Nigeria is, like we normally do, Nigeria is actually showcasing its strengths in the region and acting like the big brother for the region, whereby other countries can emulate some of the standards and the goals that we've set.
Clearly, Nigeria is a big brother and has taken the lead in the African region. Let us go to the acting registrar, MLSCN, Dr. Donald Ofili, who welcomed them and, of course, encouraged them to open their minds to learn various methods of laboratory practice as well as regulation, explaining that examination, both foreign examination and, of course, the practice itself, production of in vitro, product, importation of medical lab product are all regulated by the MLSCN. And the reason is to ensure safety and enhance the health status of citizens. So let's take a look at what Dr. Philly said.
The Medical Laboratory Science Council of Nigeria, the host of this particular study tour, is very glad to be doing this on behalf of the government of Nigeria. MLSCN is an agency of government charged with the responsibility of regulating medical laboratory science practice and services in the country. It's an act of parliament established by Act 11 of 2003, Laws of Federation of Nigeria, M25, 2004. So as a council, we are in charge of licensing and regulation of professionals, and there are other parts of our mandate that we'll explain as we move forward. Take, for instance, it's not in most councils in the continent that you find in one particular council regulating the production, the importation, sales, and stocking of in vitro diagnostics in Nigeria. Regulation of foreign graduates. We also regulate in the council accreditation of schools training medical laboratory science. So we'll get to explain some of these mandates as we proceed. The Council is very glad to welcome this delegation. And let me also hint that sometime about 30 years ago, a delegation from the then Institute of Medical Laboratory Technology visited neighboring countries within the region just to help strengthen medical laboratory technology then within the ECOWAS sub-region. And that particular visit was sponsored by the then West African Health Organization. The name has changed now, but it's the same West African Health Organization. Visited Ghana, Sierra Leone, and Liberia. The report of that visit is still in the Council, just to help strengthen the institutions within the region. So the Council have been doing this in the last 30, 40 years. And we are glad again to be hosting this delegation in the Council today. Before we officially start this process, which is starting today, we would have taken this delegation to see the Honorable Minister of State for Health. But because of some other exigencies of office, that introduction will happen within the week, probably by Wednesday, as I'm in touch with the Office of the Minister of State for Health. So therefore, on behalf of the government of Nigeria, I want to warmly welcome the delegation once again to Nigeria and specifically to the Medical Laboratory Science Council of Nigeria. So we'll be starting today, but we will be seeing the minister within 2 days from now to officially introduce the delegation to the Honorable Minister of State for Health. So therefore, I welcome you to the Medical Laboratory Science Council of Nigeria. Let me also thank the facilitators of this particular visit. I want to singularly thank Dr. Mrs. Negedu Momo for your doggedness and for what you have done in ensuring that we have these visits. Let me also thank Dr. Kayode for your insistence, continued to insist that we do the right things. And we thank God that today that this visit is happening. I can see a couple of friends from the Gambia. The director, please look up. Yeah, I can see a couple of friends from the Gambia that I've met in the past. You are welcome to Nigeria. The council regulates over 40,000 medical laboratory scientists in this country, as well as over 30,000 medical laboratory technicians. So it's a very big organization. We have zonal offices across the country. We have some state offices. You will get to really understand our activities and our mandates as we progress with this visit. Therefore, thank you very much for coming. Our friend from the National Assembly, we also are aware why you are here, because we are about to develop the draft document that will help in establishing the medical laboratory regulatory agency in the Gambia. I'm also aware that within next week or so, that you also be visiting some other sister agencies. I don't know if it's still part of your plan, but we'll get to hear your plan as we progress with this meeting.
Right, this is where, of course, we must give credit to the MLSCN for what it is doing for a country to say, hey, I like what you're doing concerning regulation and, of course, practice of medical laboratory science, and I want to understudy you so I can replicate that in my country. It means that we have come of age. We are doing just very well. The MLSCN has got it with all certification and ensuring that things are done based on international best practices. So kudos to the MLSCN. This is where we'll wrap up today's edition of the program, Health is Wealth. Joseph Kadri is my name. I'll be here again, same time, same station next week. Do have a nice day.